Welcome back to another episode of the Grow RDH podcast. Thank you for being here. If you're new here, my name is Katie and I'm a dental hygienist from South Dakota. And I just like to get on these podcasts and just talk about things that I am passionate about and things that I think are fun to talk about. And if you are a repeat listener, I appreciate you coming back. Please consider liking, subscribing wherever you're listening to. I am on YouTube and Spotify. So share this with a fellow hygienist who you think might really enjoy this content. Today, we're going to continue our conversation on motivational interviewing. This is leading up to a motivational interviewing workshop. And so if you want some hands-on skills or practice doing some of these things, please check out the link in the description and see if the motivational interviewing workshop would be right for you. If you're listening to this at a later date and you still are interested in motivational interviewing, I give CEs on motivational interviewing a lot. It's something I'm really passionate about, and I would love to work with you on getting some content or some practice doing this. So please reach out anyway. To follow up, the first episode in this series was about the spirit of MI and why MI is so important in building patient relationships. Last week, we talked about the history of MI and Dr. Miller and Dr. Rolnick and how it was introduced in healthcare to really inspire behavior change and get some really positive healthcare outcomes. We talked about Dr. Miller and Dr. Rolnick and how they developed MI both in addiction studies and in healthcare to really get some great outcomes when it comes to behavior change. And that's what we want. We want positive outcomes. We want holistic approaches in how we treat our patients and communicate with our patients. And that's what MI does. So we haven't quite talked about empathy yet. And empathy, I think, really does come into play when we're talking about motivational interviewing. So today, as we go through the skills, we're going to talk about 4 different skills that MI employs to communicate to patients about behavior change. And every single one of those techniques require empathy to be worked well. Everyone at least deserves empathy, the very least. And so the skills that we're going to be talking about today include OARS, and that's an acronym for open-ended questions, affirmations, reflections, and a summary. And I'm going to be discussing or giving examples specifically about dental hygiene related issues and what that looks like in the dental hygiene context, right? We only have an hour. And so typically in that hour, we have a lot to squeeze into an appointment. And so hopefully you can see how using these tactics throughout a 1-hour appointment can really benefit you when it comes to learning the skills, practicing the skills, and putting them in places where they make sense in the appointment. So first we're going to talk about open-ended questions. Open-ended questions seem easy. It's easy to understand what it is. And what it is not is a question that you can answer with a yes or no question or answer. But what I want to say is that there is a lot of not open-ended questions that you can't ask yes or no. And the more you do this and the more you practice, it's hard to think of an example. It's something that a patient can answer that it may not be open-ended, but it may be very brief or very short. And so let's talk about what open-ended questions are good. So open-ended questions initiate a deep reflection and response. So it is a question that requires them to think about something and personalize it, and their response is going to be something deep. Their response is going to be deep and meaningful, and it's going to be something that you can sort of take pieces of information out and use it to your advantage. And so the better open-ended questions are, the more you can get from them. When we're learning this in a classroom setting, a lot of the times we train students to ask gauging questions, and I'm going to use tobacco cessation, for example. And a lot of the times that's kind of the example we use. This could be anything. It could be anything else, but we're going to use tobacco for an example. And so a gauging question might look like, on a scale from 1 to 10, how likely, 10 being the most, 1 being the least likely, how likely would you be to be able to quit smoking in the next 6 months? And the patient's going to give you a number, obviously, on the scale. And so if they say a 7, this is where the open-ended part comes in. You're going to say, what made you choose a 7 and not an 8 or a 6? And that's going to require deep reflection. They're going to think about an 8. Why didn't they bump it up to an 8? The reasons that they didn't bump it up to an 8 are going to be their feelings towards smoking. So it may be like, well, I've tried smoking before and it didn't work. So I'm doubtful that smoking is going to be something I can quit. Then you can follow up and say, but why didn't you say a 6? You said a 7 instead of a 6. So there must be a reason, you chose a 7 and not a 6. And that's going to be the sweet spot where you're like, oh, okay. They have to think, well, I do know it's really important and it's linked to how well I'm going to heal after periodontal therapy. So, based on the importance, I really put it at a 7 because I know it's something that I want to do. I just don't know if I can do it. And that's a gauging question. And that really does require them to do some deep reflection about either one of those numbers on either side. It's going to initiate change talk or sustain talk. Sustain talk are the reasons why they didn't bump it up a number, and change talk is the reasons why they didn't bump it down a number. So you can use both of those to your advantage. And in the MI workshop, we'll talk about kind of how that feels when we actually do it. Next thing we're going to talk about is affirmations. Affirmations are important to build patients' confidence. And these are positive statements about things in their behavior that they've done in the past. It's easy to read people's bullshit though, right? Patients have a bullshit meter. And if you're just pumping sunshine up there, they're going to feel that and they're going to know that. Affirmations are not just empty compliments. Affirmations aren't shallow. In order for affirmation to be successful, it has to be specific. And the only way you can make it specific is if you really know that patient well and you can build a relationship off of things that they've done. If they struggle with coming in every 3 months, an affirmation is, I really appreciate that you've taken the time to come in today. This is a really important appointment, and your commitment to coming in just shows how much you value this therapy or this maintenance. It is very specific, and again, personalize it as much as you can. It will help build connection, and it will really make a difference in building confidence. Patients need to believe that they can do something, even if that's minor. So if the patient has never flossed before and you want to incorporate some sort of interproximal cleaning, have them pick something that they can do. And I'm getting ahead of myself because that's getting into the summary phase, but have them pick something that they feel like they can do. That way you have at the next 3-month appointment some affirmation of something that they did good. The next thing is reflection. You're going to be able to reflect on a patient's thoughts and feelings with as much as they give you. And so I'm going to bring it back to open-ended questions and say, if you're asking good open-ended questions, if you can reflect back what they said. If an open-ended question is poorly done and doesn't require them to give you a deep response, reflections are going to be very difficult. The more they give you, the more you can reflect back. It's really important to show active listening through reflections. And the way that you're going to do this is that you're going to paraphrase what they said and repeat it back to them. So a patient said, I didn't choose an 8 because I've tried quitting smoking 3 times and I wasn't successful. So I doubt I'll be successful this time, but I didn't choose a 6 because I really know it's important. A way to reflect that back might sound like, it sounds like you've tried smoking before and you haven't found much success, but you do know it's important to our periodontal therapy that we're doing. So you really want to be successful this time. Is that correct? Does that sound right? And by asking, is that correct? You're allowing them to identify any miscommunication that might be happening. This is important, especially when it comes to emotions. And if you're able to reflect back a piece of emotion, so it sounds like you were really defeated. It sounds like you were kind of bummed that you tried 3 times, and so it made you feel less confident. Does that sound right? And they can say, yeah, it really hurt my ego. Like, I really wanted to quit and I just wasn't successful. So I feel like a failure. Now, that's deep. And I'm not saying you need to get that deep with every behavior change. It might be something as simple as water pick use. But your ability to include emotion or include how the patient felt about what they said, emotions or significant meaning in your reflections, the better you're able to relate to them and, again, build trust. Finally is the summary stage. And I think this is very dental hygiene specific. When we do role plays in the classroom, we always end with a summary. And what we know about behavior change is that patients are really only able to make one change at a time. And they're way more successful when they choose one change at a time. I think it's important that we don't have the patient commit more than they're able to. If we're setting them up for failure at the first appointment, your 3 to 6 month recalls are going to be harder. We want them to be successful at one thing. This is a long-term process that we're building and growing with them. And so if we tell them you need to floss every day, you need to use your water pick every day, and you need to quit smoking in 6 months, and they're going to look at you and be like, okay, and walk out the door, then they'll go and not do those things, come back, and they will have failed. Versus a summary allows them to choose. I would love for you to floss a little bit more. I want you to use the water pick, and I want, and it would really help quitting smoking. Of those 3 things, what would you like to focus on in the next 3 months? I would love for you to pick one goal and see how you can employ that goal. And then after 3 months, we'll talk about if the change worked and if there's anything else we want to commit to. Choices give control. Even if they don't want either choice, they're still going to feel empowered that they're the ones that made that choice. And that's really important for them to feel confident, for them to feel empowered, and for them to make a behavior change that they're going to stick with. So summaries allow a patient to make the choice. We give them a couple options, and then they get to pick what it is that they think that they can have the best chance of doing in that time frame. And that not only gives them confidence, it builds confidence over time, but it also makes them feel empowered, and it feels like they have the autonomy to choose what type of behavior change is best for them, and it makes them feel in control. And we all know we want to be in control and we want to make our own decisions. So if we can do that, it really gives them ownership over overall what healthcare outcomes that they're looking for. And that is all 4 of the techniques of open-ended questions, affirmations, reflections, and summaries, or OARS. Those are the techniques of OARS that we can use chairside to employ motivational interviewing. And again, the workshop is great because it allows you to put it into practice. It gives different scenarios, and it just is really helpful in how this would be done in the real world setting. So I encourage you, if it's not mine, to do it someplace else, or do it as a team building workshop at your office or something, and put it into practice. Role play with each other, even though it feels weird. If you role play with each other, it really does help you practice it, because it does feel awkward the first couple times you do it. And the more you practice it, the better that you're going to get. Hopefully you feel excited about this. Hopefully this is something that you can put into practice today and really see the benefits over time. Thank you for listening. And we will see you next Friday on the Grow RDH podcast when we wrap up this motivational interviewing series. And we look forward to seeing you there. Again, please like and subscribe and share this with a friend who you think might enjoy this content. We'll see you then. Bye.